Good morning.
Good morning.
Okay, why am I big? Hold on. I don't understand that. All right, there we go.
I
How are
heard
you?
you were a chocolate lover, so I wanted to share this cookie with you. This
Sir?
How are
one's
you?
I'm good. I'm good. We got the gray memo, I see. All right, there we
We got gray
go.
what?
The gray memo.
Oh, it's blue.
Is it blue? It looks gray. Your
Oh,
shirt looks gray.
no, it's it is gray. Oh,
Sir, I
oh.
know. Sir. I cannot. Oh, but you got the coding shirt on.
Yes.
Yes.
Read the guidelines.
Read the
Read the
guidelines.
coding guidelines. Yes.
That's right. I love it. Love it. Love it. Okay. I don't know why. Maybe it's me. Okay. Let me turn this up. You sound low to me.
which I
Do I see? I had a little mic and everything, but when I plug it in, I can't. I can't hear. I gotta play with it.
Oh, okay. That's why I got, well, my trade secrets. I have two headphones. I have two different ones. One going to the mic so I can hear the mic, and one going to the computer so I can hear y'all. That's why I don't know
Eh,
how to do it any other way. Look, I haven't. Well, I think there's some very highly sophisticated headphones, earpieces, in ear something that I probably could research, but haven't had the opportunity. So you know how we do. We figure it out.
Exactly. And I've had these for the longest, but I never use them for that very reason. Well, actually, I thought I had plugged it up. I thought I was charging them. I forgot I had to take the little strip off the bottom.
Sir. Oh my goodness. Wow. So how was your week?
It was a week,
It was
you
a
know.
week. It was
Yeah.
a week. I think the weather is killing me. It was warmer up north than it was here in Cincinnati when I was in Columbus. It was warmer there. I'm like, what is happening? What is happening? But okay, all right, all right. Let's get this party started. Let's see. All right. Well, welcome everybody to our Saturday morning tea. Here we brew up the hottest topics in healthcare. We discuss health information, news, education, certification tips, the technical challenges that we go through.
Hmm.
Not look our color blindness because that shirt
Yeah.
is straight gray. Entrepreneurship and really everything revenue cycle at large. So as you come in, don't forget to hit the thumbs up or like button. I'm Clarice Warner, the girl with the pearls, the founder and senior education director of the Professional Reimbursement Network, LLC, where coding education is key. And PRN is a healthcare compliance consultancy located in Cincinnati, Ohio, that specializes in revenue cycle and regulatory compliance and education. Now, let me ask you, do you know what it takes to be a certified, marketable, ooh, so that just triggers me now in our climate medical coder. Well, before I introduce you to my co-host, let me share with you information on a free, yes, free 99 email course on the 5 steps to become a certified marketable medical coder. Are you interested in medical coding but not sure where to start and scared of wasting time and resources? Let me help you with the right steps to become a certified marketable medical coder. Learn more at bit.ly/5stepscoder. Hey, hey. You know, I love my music. I love it. So, if you are interested in getting more information about the 5 steps to become a certified marketable medical coder, check the video description for the link. All right. Well, joining me today is my partner in success, my co host, Mr. Jesse, the registered trademark. Put some respect on his name, the coding nurse. Sir, introduce yourself and tell the folks all about you.
Good morning, everybody. My name is Jesse. I live in Philadelphia. I've been in healthcare for a long time. In 2014, I left the bedside and I transitioned into risk adjustment. So during the pandemic in 2020, I created a company, the Coding Nurse LLC, where I help nurses and other people in healthcare with a clinical background transition into the wonderful world of HIM.
And how's that working out for you?
It's coming along.
It's coming along.
Hmm.
He works all things, doesn't he? He works all things.
Sure does.
And give your verbal resume over these here internet streets. I love it. I love it. All right. So before we jump in, let me remind you that you can join in and add to the conversation. So don't be shy. Your opinion matters and is welcomed here. So use the chat, whatever platform you're on. Just use the chat. We'll check you out and look and see and all of the things. We won't multitask. We'll do two different tasks, not multitask. I heard a whole speech about multitasking that just shook my whole core. I said, you know what? You are absolutely correct. but we'll look out for your information. And if you have a question for us, please type Q first. So we definitely know that it is a question for us and we don't miss it. So let's see. As I say that, good morning, Tanika. She's falling out laughing. Is it because of that gray shirt? Good morning, Dr. K. Welcome, welcome. Okay. I said I was going to check. I don't know how to do it. I don't see, no, there's no comments here, over here on, in the grams. Okay. Yeah. All right. Let me pull that down. All right. So let's get to it. So for those who are joining us or watching the replay, today we are talking ICD-11, the 2025 update. Did you know there was a whole update to ICD-11? Well, I did. So when I found out, I said, well, because I didn't, other folks may not know either. And so
That's right.
About that. So what coders need to know? But first, our church announcement. Oh, good morning, Crafty Coder, our on the street correspondent. Let's get into our church announcements. Hey.
Where those amens at?
Amen. Where them amens at? Hey. Oh, that video you sent me was hilarious. I was like, I won't forget Zora. I want Woody. Jump out the toy box. Hey. All right. So, church announcement I have for today. Other releases that have occurred, the ICD-10 CM, PCS, and coding guidelines for both have been updated and released for April, and those have been released. We'll probably talk about that more in depth next week. That will probably be our topic for next week. The other thing is there was no March maintenance and coordination meeting, which in the decades that I've been in this industry, we've always had a March meeting. There was no March meeting. I said,
you know why?
No. I said, why are they messing with us? Why are they messing with us? I don't understand. So that didn't happen, didn't occur. No information, no nothing, just crickets. I attended our Ohio Health Information Management annual meeting this past week, which means I missed AHIMA's advocacy, which, I'm a little sad about that because I love the advocacy meeting in Hill Day. I heard there was wonderful, wonderful topics over there, but we had some great information. And the one thing that I heard that really, but first, let me just say, we went to a new venue, beautiful venue. We toured it last year to prepare for this year. Why they didn't tell us they were going to have construction while we was here? I said, so when we get there, we were like, well, what's all of this construction happening outside? But true to form, our senior executive director, I want to shout her out, Lauren Manson, who is every woman. It's all in her. Just hit the ground running, kept everything moving, didn't miss a beat, was just excellent. And so we had a wonderful, wonderful time there. But the one thing that I heard about, and be on the lookout, we'll introduce this as a future topic as well. This attestation that is required for reproductive health is off the entire chain. I said, excuse me? It is crazy. And so it was a lot of the buzz that was mentioned at a lot of the sessions. Jennifer Miller and Tanya Bates, Jennifer Miller that you all know from AHIMA, came and gave the AHIMA address. Tanya Bates is our Ohio representative who sits on the AHIMA board. They gave a wonderful AHIMA update. It was a little hot seat, folks. It was a little hot seat, but they handled it gracefully and provided great information for the members. Even broke it down to the financials. I said, y'all better come with, had a whole financial chart, got to go in and look and see. It was all of the things. So if they're coming to, if you are having an AHIMA update, I would request that you ask for that slide deck, because that slide deck is really, really good and provides a lot of information about what is happening in the world of AHIMA. Let's see, what else? I think that's it. That's all I got. It was a very, very, very busy week. I've been traveling. I took my whole family to Columbus. So you can imagine. I was running around like a crazy person, but it was all good. Had a good time. Do you have any church announcements, sir?
I do, but we just want to shout out Dr. Jasmine.
Yeah, hey, I know I
Hey,
missed
Dr.
it.
Jasmine.
Y'all know I'm normally in DC. I'll be there next year though. And unfortunately, because OHIMA usually has one of the first annual meetings, it sometimes bumps up against when the advocacy Hill Day is. And so sometimes I miss it and sometimes I don't. But I think next year we already received something about your dates, and so we should be good. But yeah, and then we book our stuff out 3-4 years in advance. So yeah, and because it was a new venue, I had to be at OHIMA, but I'll be in DC next year. Yay, Lord willing, and the creek don't rise.
There you go. All right, so my only church announcement is I have an ICD-10 CM class starting on Thursday, April 17th, 2025 at 6 p.m. Eastern Daylight Time.
Okay.
Anybody who,
because I'll be butchering whatever it is. Whatever. It's Eastern. But go ahead.
Anybody who is interested, you can visit my website, thecodingnurse.com, to learn more information about signing up and registering.
Look at you.
Hope to see you there.
Oh, whoa. Wait, look at you. Sounding like a commercial. Don't make me call you, get that all recorded and put you in a commercial deck. Don't play. You know that I love to do it. Oh, well, good. I'm excited. That's wonderful. Because the way these ICD streets are rolling, everybody need to get in. You do. Is this just CM, or do you also do PCS in your course?
I do offer PCS, but I offer PCS only for people who have CM knowledge, because you can't.
Absolutely.
That's like,
you got to start somewhere and build. Cool. All right. Let me get rid of this. Okay, I was like, am I still hearing the song in my ear? All right. All right, well, let the tea spilling begin. So again, good morning, beautiful people, and welcome to our Saturday morning tea. Today, we're diving into something that will actually impact every single one of us in the medical coding world, actually in the healthcare world overall. Now, let me preface this that this information is from the World Health Organization. And we know that as our current administration, we're not necessarily World Health Organization friendly. So hopefully we'll keep those same partnerships and ties, and they will continue to include us in things that are happening with them. But we're going to talk about the 2025 update on ICD-11 that the World Health Organization announced on Valentine's Day. So again, this isn't just another minor update. This particular update is regarding the enhancements to the systems that we use every day, or the systems that we use in healthcare for our type of work. Let me pull this over here. Okay. If you're brand new to coding, or you've been doing this for decades, like myself and my co-host, these changes will affect your workflow, your accuracy, and ultimately your professional success. So get your tea ready, get comfortable, and let's break down what you absolutely need to know about the 2025 ICD-11 update. And don't forget to subscribe if you want to stay updated on all the latest changes in our field. So before we dive deeper into the 2025 updates, let's take a moment to level set to make sure we understand how we got here with ICD-11. So this historical context is important because it helps us to appreciate the magnitude of these changes. So the International Classification of Diseases, which is ICD, has a long history dating back to the 19th century. But ICD-11 represents the most significant overhaul in its evolution. The World Health Organization began the ICD-11 revision process back in 2007. That's a long time. Recognizing that ICD-10, which was developed in the 1980s, wasn't designed for the digital health era. What makes ICD-11 revolutionary is that it's the first version built from the ground up to be used in an electronic environment. Previous versions were essentially created as books and later digitized. With ICD-11, on the other hand, it was designed as a database with a sophisticated structure that supports electronic health records and digital health systems. So it allows it to seamlessly migrate with the actual systems that we're using. So I know we talked before about the digitalization of ICD-11. And that's what they're talking about, that it's able to migrate and communicate with the various digital systems that we often use in healthcare. The development of ICD-11 involved unprecedented global collaboration. Over 270 institutions and thousands of experts from all continents contributed to its development. These weren't just statisticians and coders, but also clinicians, epidemiologists, health information managers, and even patients, ensuring that the classification would serve multiple purposes. So a major milestone occurred in May of 2019 when the World Health Assembly officially adopted ICD-11. And then on January 1st, 2022, ICD-11 formally came into effect globally as the international standard for mortality and morbidity statistics. The World Health Organization actually stopped maintaining ICD-10 back in 2018, signaling their full commitment to the new version. So, what many people don't realize is that ICD-11 isn't just a coding system, it's built on a foundational component that serves as a biomedical ontology. This foundation links ICD-11 to other terminologies and classifications, making it a powerful hub in the digital health ecosystem. Another significant aspect of ICD-11 history is that it's the first version to fully incorporate traditional medicine. This was done in response to the fact that traditional medicine is used in many countries worldwide, but had never been properly integrated into international health classifications. So the 2025 update that we're going to talk about today represents the continued evolution and refinement of ICD-11 based on global implementation experiences since its launch. So the World Health Organization committed to annual updates to keep the system current with medical advances. And this update reflects that commitment to ensuring that ICD-11 remains at the cutting edge of health classification. That was a mouthful. Okay, so let's start with the key updates in the 2025 edition. And Mr. Jesse, you jump in however you see fit,
Okay.
like double dutch. Hey. So the World Health Organization has been working on making ICD-11 more comprehensive and user-friendly, and this update really shows their commitment to that. First, we're seeing advanced natural language processing and API-based coding features. So what does that mean for you? It means the system is getting smarter at understanding medical terminology as it's actually written in clinical notes. Instead of having to translate physician documentation into codes manually, the system can now suggest, that's really important right there, suggest appropriate codes based on the text itself. For example, if a provider writes patient presents with elevated blood glucose consistent with type 2 diabetes, the NLP technology can recognize key terms and suggest the appropriate diabetes codes. This would significantly reduce the time you spend searching for the right code. Second, they've improved error detection with enhanced spelling correction. We all know physicians sometimes use abbreviations or have unique spelling in their notes. The new system is better at recognizing those variations, and so you don't have to go back and forth clarifying documentation as often. Third, there's improved language variation recognition that reduces errors in data entry. This is huge for international healthcare organizations or facilities that serve diverse populations. The system now recognizes different ways of describing the same condition across various English dialects and medical terminologies. Fourth, this one is exciting. There's multilingual expansion. So ICD-11 is now available in 14 languages with ongoing expansion to improve global accessibility. This means more standardization across the globe, which is particularly important for research and global health initiatives. And finally, there's a new module covering traditional medicine, which I mentioned earlier. This allows for systematic tracking of traditional medicine services, enhancing global research, reporting, and evidence-based policymaking. For those of you working in integrative medicine settings, this will finally give you the tools to code these services properly. So another thing that's remarkable about these updates is that they're not just about adding new codes. They are about fundamentally improving how we interact with the coding system itself. So the World Health Organization is recognizing the future of coding isn't just about classification, but about interoperability and ease of use. So let's talk about how these digital transformations will impact your daily work as a coder. The FHIR API integration is a game changer. And for those who aren't familiar, FHIR stands for Fast Healthcare Interoperability Resources. And it's the standard for exchanging healthcare information electronically. With ICD-11 now integrating with FHIR, we're looking at seamless real-time data exchange across health systems. And what this means practically is that when you enter a code, it can immediately be shared with other systems, from billing to analytics to research databases with minimal friction. This reduces the need for manual data entry across multiple platforms, which we all know is both time consuming and prone to errors. So, the advanced natural language processing I mentioned earlier deserves more attention because it's revolutionizing how we approach coding. Instead of reading through documentation and manually selecting codes, the NLP can analyze the text and suggest appropriate codes. You'll still need to verify these suggestions. That's where the human body comes in. Your clinical knowledge will never, ever, ever be obsolete, but it significantly speeds up the process. So this shift is smarter automation, is designed to make coding faster, more accurate, and less disruptive to patient care. When we can code more efficiently, healthcare providers get their reimbursements faster. Researchers get more accurate data, and ultimately, patients receive better care based on more reliable health information. Also, there's this new intuitive design, which means training requires fewer resources and less time. So, for those of you managing coding departments or training new coders, this is huge. The learning curve for ICD-11 is less steep than previous versions, allowing new professionals to become productive more quickly. So all of these digital enhancements allow health workers to focus on what matters most, which is providing quality care to patients. And by reducing the administrative burden of coding, healthcare professionals can spend more time on direct patient care, and coders can focus on the more complex aspects of their role rather than routine coding tasks. Remember, these changes aren't meant to replace your expertise. They're designed to enhance it. Your understanding of medical concepts, coding guidelines, and the healthcare system remains invaluable. These tools, and that's what we need to use them as, these tools just help you apply that knowledge more effectively. So, Ms. Jesse, you have anything you want to?
I wanted to jump in 5 minutes ago,
All right, I told
but
you.
no. But I didn't do it because I just don't want to seem like a Debbie Downer. But this sounds very, very pie in the sky to me. And I just don't, I will have to see it because, you know, I mean, we know NLP is not new. NLP has been
Correct.
around since at least 2014.
Correct.
That's when I first encountered it.
Correct.
And I can honestly say in 2014 to now, like I'll say 2024 was the last time I actually did a chart review. The documentation hasn't gotten any better. So if all of this is based off of poor documentation, we still are right back to where we are right now.
We all know that the key to
Right.
any of this operating or being efficient is the provider documentation.
Right.
Period, point blank. So while I think the tools that they're putting out or the different modules or things that we are using as tools to assist us in doing our job is only as good as the documentation that the providers provide to us. And I feel like there needs to be a whole other conversation for providers in making sure that they are documenting appropriately. I think for whatever reason, that conversation is minimal because it's I think it's being overshadowed by the administrative burden or the what would you say all the time?
Compassionate sacrifice.
Yeah. So I think it's muffed out from all of that. And so, they're pushing that agenda when really the agenda needs to, well, if you were documenting more efficiently and accurately, nobody would be tapping you on your shoulder or sending you queries or having these additional conversations, or you would need this additional education and all of the things. So if that front end process of the documentation by these providers and the education for these providers on documentation would occur better, accurately, completely, then some of this downstream stuff wouldn't apply. Like we wouldn't have to send the queries. We wouldn't have to continue to bother you. You wouldn't feel this administrative burden because your stuff would be right the first time. I mean, yeah.
Tanika, you hit the nail on the head.
I didn't see what you said. We're still circling the same block, just in an up-to-date vehicle. Right. I mean, because they're not changing how they document.
Because the part that gets me, and I think that it is, well, I mean, we know that technology is here to stay.
And we're moving.
It is going to advance.
Absolutely.
And I think that it could be helpful. But the part, like, it a lot of us have worked in some way, shape, or form with NLP and with these auto-suggested codes. And some of these auto-suggested codes are crazy.
Which is why you need to know your guidelines, which is why you need to know the information. Go ahead.
That really is that's another one of my sticking points, because what I see is that now there is almost like it's almost like a cavalier disregard for guidelines, because everybody is so focused on these encoders, like the encoder is going to do everything for you. And it's just not going to end well if we don't change what we're doing currently. And it's just going to be just what Tanika said. We're just going to be in a newer, in an up-to-date vehicle. But the sticking points are still going to be there.
And I think that also opens up another educational opportunity for coders who are, well, most of coders, depending, well, in large systems, I know they're using these encoders. There needs to be understanding that, again, these are suggestions for you. These aren't the end all be all. And so you have to have a working knowledge of, because they may just, again, in my practical brain and how I see all of this, you have the tool kind of going through and picking out and reading and abstracting what we used to do back in the day, abstracting these terms. And so they're seeing these terms, these diagnoses, and they're going to say, oh, okay, based on what I see, here are some choices for you, or here are some things. Now, coders, in my opinion, should not be taking, oh, well, these are this is it. This is the goal. This all I gotta put in, and my stuff is done. No, because we all know that there are oftentimes guidelines that suggest the sequencing of these codes. They're just listing the codes based on how they see them. My understanding, and with my use of encoders, they're not as intuitive to make sure that the sequencing is actually correct. They're not providing that. They're just listing, again, the thing. It's like a problem list. They're listing the problems that they see in the documentation. You, coder, have to bring your skill. You, coder, have to bring your knowledge of the guidelines and the sequencing and all of those things that you've been taught in order to make sure that these things are coded accurately and completely. So
I agree.
It's just something to assist you. It's not to the end all be all. Oh, I got an encoder and it's telling me da 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 da. Well, are you validating that? Are you making sure? Because yay, I'm glad that ICD-11 now has some additional enhancements to it that will allow it to kind of understand or do maybe a cursory or secondary review of, the documentation and abbreviations and the variations in dialects and all of those things. But you still need to make sure that what it said is there on top of making sure that you're coding it correctly and sequencing it appropriately.
That has just been my concern the entire time, because I just, from what I have experienced and what I hear people, like, I hear way more talk about encoders and encoding than I do guidelines. I don't even hear people talking about guidelines aside from us on Saturdays. You just don't. And that's why I had this t-shirt, Know the Code and Guidelines. That's where it starts and ends. Like, it doesn't matter that, I mean, because it's just that's part of my, just frustration with the industry, period. It's like, can we just get back to basics? Like, let's
Right.
just start there.
And so
And
that
then,
is truly an educational opportunity right there.
and it's just, I don't know what's going to happen in the long run, but we're going to be circling the block, and hopefully I can figure out a way to make a whole lot of money.
That's where entrepreneurship comes in.
Yes.
Because clearly there's a gap in education.
Because
Again, our educational opportunity. I
because
said that 3 times, right?
the meeting after the meeting is going to be good, because nah,
All
you got
right.
to set your people need to be setting themselves up now, because we all know that when they change code says there are massive training opportunities.
Massive,
So
massive.
you set yourself up so you could be successful to take advantage of these people who are going to certainly F it up.
Absolutely. Absolutely. All right. So let's see. Let's talk about implementation. So many of you are probably wondering, when do we need to start using this, and how do we prepare, and what resources are available? So the World Health Organization first adopted the ICD-11 at the World Health Assembly in 2019. And then, like I said, it officially came out in 2022. And this update builds on that, but the transition is designed to be gradual, and many facilities are still in various stages of implementation. And here in the US, we haven't even adopted it yet, because they're still on the fence or figuring out whether or not a clinical modification of some sort will be necessary. What's important to understand, which is scary, well, we'll talk about that later. What's important to understand is the sheer scope of ICD-11. We're talking about approximately 17,000 diagnostic categories and more than 130,000 clinical terms for injuries, diseases, and causes of death. And the code combinations enable documentation of any clinical detail with automated software support for up to 2 million terms. This is significantly more comprehensive than ICD-10. For implementation, as with all implementation, you should start with education. Make sure your team understands the differences between ICD-10 and ICD-11, particularly the new digital features. The World Health Organization has provided extensive resources, including implementation guides, educational materials, and technical support. Next, you should assess your current systems. Will they support the new digital features of ICD-11? Do you need to update your electronic health record system? Talk to your vendors about their ICD-11 implementation plans. That will be helpful, especially if you're continuing on with a particular vendor. Then develop a training plan. Even with the more intuitive design, your team will need training on the new features and coding guidelines. Consider a phased approach, starting with the most common diagnoses in your facility. Finally, establish a timeline for implementation that works for your organization. This might involve parallel coding for a period to ensure accuracy and identify any issues. And remember, over 270 institutions, health workers, epidemiologists, allied healthcare professionals, health information professionals, patients, and statisticians from all continents provided extensive input to ICD-11. And so it's designed to be more user-friendly and clinically relevant than previous versions. And if you want to see a more detailed walkthrough of the implementation process, you can actually, I believe you can go out to the World Health Organization website, and there is lots of information regarding that. So let's address some questions that I know many of you may have. So do I need to learn a completely new system? Well, not entirely. ICD-11 builds on the foundation of ICD-10, but with significant improvements. And the basic principles of diagnostic coding remain the same, but the tools and the features are enhanced. Well, will coding become automated, threatening my job? Well, I know this is a concern that we often hear, but I want to reassure you that coding is becoming more efficient, not obsolete. Again, your expertise in understanding medical concepts, applying coding guidelines, and ensuring compliance remains essential. The automation is designed to handle the routine tasks, allowing you to focus on more complex coding scenarios. I know at OHIMA there was Optum. The folks from Optum had a presentation, and they too had to admit, like, we don't believe that our systems or the AI will replace bodies at all. We always believe that there will be a need for actual coders. And then what they said was, which was making me cringe, and I even had to go after the session to tell them, we're coders, we don't have licenses. So they kept saying, well, you need to operate at the top of your license. I say, I don't know. I know that's what folks say who have licenses, but we have certifications. So maybe we need to operate at the top of our certifications. But that licenses, that's not us. That's not what we have. But I get what you're trying to say. But ultimately, they were even recommending, but somebody needs to validate because of the hiccups and because of all of the different things that you do see with any type of AI type of systems, and natural learning or NLP is one of the many components of AI systems. So you still have to validate, and you still need people to do that. So no, we're not going away. We're here to stay. Yay, yay.
There you go.
Give me a rope, right? I'm gonna go a mile. So, how will this affect reimbursement? Well, initially, there may be some adjustment as payers update their systems to accommodate ICD-11. However, the greater specificity and accuracy of ICD-11 codes should ultimately lead to more appropriate reimbursement. Is there a penalty if a country does not complete ICD-11 implementation within 5 years? According to the World Health Organization, there is no penalty for countries that don't meet the implementation timeline. However, delaying implementation may impede the benefits of up-to-date medical classification and hamper global data comparability and interoperability.
But
Go ahead.
A lot of people now, I know I was shocked when I found this out, that even though the United States lags behind in terms of everyday use of the code sets, these county, I guess you'll call them these state vital statistics offices, they use the code sets as soon as they come out because they have to for international reporting. Like they were using, like morgues and stuff were using ICD-10 before it came out, before we were using it. And I'm sure they're using ICD-11 now before we are, because they have to report those mortalities internationally.
Mm-hmm. Okay. Do I need special software to use ICD-11? ICD-11 is designed to work in both digital and non-digital environments. However, to take full advantage of its feature, like the API integration and NLP capabilities, you'll need compatible software systems. So the World Health Organization provides some basic coding tools for free, including a browser-based coding tool available at icd.who.int. She said, yeah, with that many codes, ain't no books. I still don't see where there won't be any books available. I haven't run across that.
There is going to have to be something.
Go ahead.
Only because our healthcare system is unlike any other healthcare system in the world.
Mm-hmm.
And when it comes to reimbursement with these insurance companies, it's not going to be like that, because you have, even if it's not a quote unquote code book, there's going to be some kind of book that categorizes or helps you navigate it. It's going to have to be.
Absolutely. Absolutely. With guidance
Mhm.
to that point. So yeah, and even this information that we're discussing today was actually linked in the video description, and it comes directly from the World Health Organization's website. And there is nothing there that stated that there wouldn't be any books. And we're the United States. You know, we don't have a book.
What would these book publishers do? They've been
What would they
published
do?
for
That
years.
book of business ain't going nowhere. Everybody trying to make a book. And that was the one thing about the diagnosis coding sets, because it was open license. It was free to anybody. And that's why all of the different people, that's why you have an AAPC book. That's why you have an AHIMA book. That's why everybody else and their mama can make a diagnosis book. But you know, the AMA was like, we not playing with y'all. We put a license on ours, and nobody can make a CPT book but them. So
You better not.
try it if you want to. All right. It says, do we need a special license to use ICD-11? It says, that's a great question. ICD-11 is available as a global public good. The World Health Organization provides free access to ICD-11 for all users through the official World Health, WHO website, including online platforms and downloadable versions. However, your planned use needs to comply with the ICD-11 license, which is also available on the website. Will the World Health Organization continue to maintain ICD-10 or introduce emergency codes in ICD-10 for future pandemics? Again, the World Health Organization stopped maintaining ICD-10 in 2018. However, in emergency situations like pandemics, the World Health Organization would deploy relevant specific emergency codes in both ICD-10 and ICD-11 to ensure continuity during the transition period. Can we use mapping tables from ICD-10 to ICD-11 instead of fully transitioning to ICD-11? It says, while mapping tables, or AKA crosswalks, are available to help users compare data across ICD-10 and ICD-11, they're not intended for directly converting data from one revision to the other. So significant changes in medical knowledge and coding structures limit direct equivalence. So relying solely on mapping tables instead of full implementation will likely result in data gaps and inaccuracy. Do I need terminologies like SNOMED CT to use ICD-11? No, you don't need any additional terminology to use ICD-11. It's fully equipped to function independently, offering the terminological depth required for clinical recording in multiple languages. Its design incorporates natural learning processing to support accurate documentation and coding. What resources should I use to prepare? Well, again, start with the official World Health Organization resources at the website icd.who.int. Additionally, professional organizations like AHIMA and AAPC are offering training and certification programs specific to ICD-11. Now, let me summarize the key takeaways for you to remember. ICD-11's 2025 edition offers improved interoperability through advanced NLP and API integration, making your coding process more efficient and accurate. The update includes enhanced error detection, with better spelling correction and language recognition, reducing the time spent on clarifying documentation. Its multilingual expansion to 14 languages improves the global accessibility, standardizing coding practices worldwide. The traditional medicine module fills a significant gap in our current coding capabilities. Digital innovations make coding faster, more accurate, and less disruptive to patient care, allowing you to focus on more complex coding scenarios. The World Health Organization continues annual updates to reflect progress in medicine and science, ensuring that the classification system remains current and relevant. And with approximately 17,000 diagnostic categories, that's a whole lot, and over 130,000 clinical terms, ICD-11 provides unprecedented specificity in coding. Now, y'all know that's, again, focusing back to the original documentation of a provider and making sure that they are providing the specificity that will be needed in coding accurately. Implementation should be approached strategically with a focus on education, system assessment, training, and a phased timeline. All right. So that kind of sums up the 2025 ICD-11 update. Remember, the evolution of medical coding mirrors the evolution of healthcare itself. Increasingly digital, data-driven, and focused on integration. So this update to ICD-11 represents not just new codes, but a new approach to how we understand and classify health information. And so for those of us who have been in this field for years, you know, change can sometimes be overwhelming. We know how we felt when we went from ICD-9 to ICD-10. Some folks just said, you know what, I'm tapping out. But I encourage you to see these updates as tools that will ultimately make your work more valuable, not less. And the technical aspects of coding may be increasingly automated, but the expertise that you bring to the table to interpreting and applying these codes remains irreplaceable. Mr. Jess, did you have anything you want to add?
I just think that people should see the opportunity, because based on one of the articles that you sent me, Clarice, I did a little snooping, and they had mentioned the article had mentioned APIs.
Mhm.
And APIs are these little bits of code that you use on the back end to integrate systems.
Mhm.
So I went and looked, and they have this, the ICD-11 has an API for Python.
Mhm.
So
Mhm.
I'm just going to say
Mhm.
I'm meeting with my tutor starting
Uh-huh.
next weekend.
Uh-huh. And this will be a perfect way for you to kind of dibble and dabble by using the information that's already available for you in ICD-11. So this allows you to play and lets you prepare for the educational opportunities that will be coming down the pipe. I love it. Oh. She said, yes, I agree with that part, but I don't think it will look like what we have now. No, I don't believe it will look like that, because Lord knows they would make the font probably 7 point, who can read that? But I think the opportunity or the probability that books will be obsolete, I don't think that's a high probability at all. I think books will always be available to some degree.
Because the only way you could really get rid of a book in this instance would be there could be no more causal relationships. Like, that's what you need. You need books to explain those concepts and how you use it, because that otherwise it would just do whatever.
And
Coding.
it's really important, even with the guidelines, because technically the guidelines are in your book, or you can print them out. I mean, you will be able to use a quote unquote digital book as you could now if you go out to their website to see the information there. And I think I just lost what I was about to say, but but knowing that, and they've even stated a lot of these things will be more combination coding. And so you got to understand what that means and what that looks like. And to Mr. Jesse's point, that causal relationship will be key in determining what is accurate as it relates to these combination codes. And so, again, as they even stated, and a lot of the vendors that were at our annual meeting stated, the stuff that they're spitting out are suggestions. That's why I kept saying that. Suggestions for you. You have to validate based on that. And how are you getting the information to validate that? How are you getting the information to support that? Well, you need to know the guidelines. Nobody is anticipating or expecting you to memorize these guidelines. So you're going to have some sort of reference. You're going to have something that will allow you to go back and review and verify. And then also knowing the updates. And again, the US hasn't even tapped into what ours is going to look like. So, there's still a lot on the table. And so I personally don't believe the books are going to go away. I anticipate a whole revolt if that were to actually happen.
And
but I think the digital part, I'm sorry, I didn't mean to cut you off. I think the digital part was more or less about the interoperability pieces and being able to once the information is coded, that coding can then go to multiple places. So you don't have to, okay, I put it in our system for billing, but now I got to go because I may be doing some data research. I got to put it in another system to do that, or I got to put it. No, this is going to allow it to seamlessly go into all of these different systems once it's entered the first time. And so for me, that's what I'm taking away, the digitization to me. Go ahead, Mr. Justin.
I totally agree with that. I was going to say something similar. So
okay. like minds. All right. Well, yeah. That's what we have. Like I said, next week we probably will. I'll toss up either the upcoming new guidelines that were just released, and or talking about the that attestation. No, we're probably gonna need a whole hour for that attestation because that was crazy for the reproductive health and all of that entailed. So.
One more thing, so because originally when I first started hearing about ICD-11, I had read somewhere that they were estimating for the US, like the timeline would be somewhere between now and 2027 for implementation.
Mm-hmm.
But I don't know about that now, because it seems like for all intents and purposes, our government is taking us backwards. So we might have to go back to ICD-9. Who knows? So
and it was really because there's a whole task force that was put together in the US to determine what's that going to look like. Because I think the folks on the World Health Organization side was trying to let them know, that ICD-11 should accommodate the different changes that we make when we use CM. I think the issue and the important part that needs to really be assessed, because some people were like, well, why do we even need that if it's going to do what we need to do? And I think folks are just scared to pull the chain to see. But if it's really going to do that, then we don't necessarily need to change from it. But we rely heavily on our diagnosis codes for reimbursement. And I think that's where it's like, wait a minute, because, it has to be medically necessary. And this is what shows the medically necessary reasons for the services and procedures and the things that are, provided to our patients. And so that's where they're kind of going round and round. And there was another thing, and I can't remember what it is off the top of my head, because they kept using that terminology. I went to a session about ICD-11 when I went to the healthcare compliance conference last year, and they were talking, because they had a panel that were talking about, well, where are we with ICD-11? And at that point, that's when they were saying, these are the things that are the challenges that we're trying to overcome to see whether or not, yes, we're good and we don't need to adopt that, or we're going to need to adopt that. And adopting that comes with, again, its own challenges, because then we are responsible. The World Health Organization will be responsible for the overall ICD-11, but that CM, or that clinical modification piece that we do, we're responsible for that. And so do we have the bandwidth? You see all these different categories. You see, that's a lot. So more to come. Judges, or the jury is still out. Oh, hot tea. Thank you. Thank you. All right. All right. Well, I think this was good. I think this was good.
Oh, definitely. Because it's I mean, it's on the horizon.
Mhm.
It's something that all people in HIM should be talking about, aware of, and the savvy people will be positioning themselves accordingly.
Well, come on, savvy people. Come on, savvy people. All right. All right. So, are you thirsty for fresh perspectives on the healthcare revenue cycle or healthcare in general? By becoming one of the PRNT sippers, you'll join a community of sharp minds who savor the complexities of healthcare revenue cycle. Why sip alone when you can steep in knowledge together? Come, let's spill the tea on industry insights. Here's what you can expect as a valued member of the PRNT sippers. Exclusive healthcare insights. Gain access to in depth articles, webinars, and resources, as well as conversations covering the latest healthcare trends, compliance updates, and revenue cycle best practices. Early access. Be the first to receive expert insights and guides, ensuring you stay ahead in the ever evolving healthcare industry. Personalized support. Enjoy direct access to our team of experts for guidance on medical coding, compliance issues, and revenue cycle management. We're here to answer your questions and support your professional growth. And of course, my favorite, the community connections. So join a private community of healthcare professionals where you can network, share experiences, and collaborate on finding solutions to common challenges. By supporting us, you're not only advancing your healthcare knowledge and career, but also contributing to the success of the Professional Reimbursement Network, LLC, which is a resource that empowers healthcare professionals like you to thrive in their roles, goals, and dreams. So thank you in advance for considering becoming a member of the PRNT Sippers. For the cost of about 2 cups of tea per month, you can join the community. Check out the link in the description of the video. Your support means the world to us, and we look forward to helping you excel in the world of health information and healthcare revenue cycle. All right. Well, well, well. Thank you all again for, let me move this down. All right. Thank you all again for joining the Saturday morning tea or checking out the replay. Let me ask, was the tea spilled today? We already got the hot tea from Miss Vicky.
Absolutely.
Was the tea spilled today? You can put your teacups in the chat. So before we sign off, again, as always, I have a special request for all you amazing viewers out there who are here with us watching the Saturday morning tea. If you found this episode helpful, don't keep it to yourself. Share the knowledge. Somebody else needs to know this information. And you can hit that share button and send it on its way. And hey, why not subscribe to our channel while you're at it? That way, you'll never miss a drop of our health information, compliance, revenue cycle, and medical coding tea. Also, if you have thoughts or questions or experiences that you want to share about today's topic, we'd love to hear from you. I see the comments all the time and I always go back in and I do reply. So drop a comment below and let's keep the conversation brewing. And if you enjoyed this episode, give it a thumbs up as you leave us today. It helps more healthcare professionals find our content. And also check out the Coding Nurse channel on YouTube and Instagram. Yes? Yes.
Yes.
Remember, at the Saturday morning tea, we're all about building a community of savvy, informed health professionals. So again, like, share, subscribe, and comment, and let's grow this community together. Mr. Jesse, do you have any closing thoughts?
I have a closing comment.
Okay.
I would like to shout out our on the street correspondent, the Crafty Coder, because I, it's all about timing.
Mhm.
So, the Crafty Coder, because actually I was, I knew you were entertaining, I knew you were traveling, but the Crafty Coder really helped me understand E&M,
Mhm.
the new one, because I honestly hadn't leveled E&M under the new guidelines.
Oh, okay.
I have read it, but I'm like, okay, well, I never had to apply it.
Mhm.
And Crafty Coder came through with a resource that was way better and way easier to understand than what AAPC put out, which I don't know why they would just not use what she had recommended. It's a whole lot easier, and I just wanted to thank her.
All righty. All righty. Well, thank you, Crafty or On Street Correspondence, for helping out.
Yeah.
All right. All right. Well, this has been a great session today, and see you PRNT sippers at 10:15 a.m. Eastern time. And remember, be safe, be kind, and don't wish for it, work for it. Until next time, take care, have a great weekend, and we'll talk soon.
Bye-bye.
Bye-bye.